So we are here today in Malta with one of our PRM trainee, and I'm just very curious about how did you get into PRM training, which is a very small specialty in Malta.
So the way the Maltese system works, it's very similar to the UK, the British system. So we have 2 years of foundation program, and then we go into internal medicine or general surgery training for 2 to 3 years. We get our MSP or MRCS. And along the way, we have different rotations. So as an internal medicine trainee, I had rotations in neurology, in geriatrics, in rheumatology, in oncology. And I sort of always felt like there was always a question mark, something that didn't completely satisfy the job satisfaction. And then I had a colleague of mine and a friend of mine, and she mentioned to me that Andre had been a lecturer to the junior doctors, the foundation program doctors. And she told me, so rehab is an option, you might be interested in it. And when I spoke to Andre, I realized that it had a combination of different specialities. And it always goes beyond simply looking at the patient's condition or diagnosis, and you look at the person as a whole, and you ensure that sort of they can function and participate in society and live a fulfilling life, compared to focusing on.
That's really good. So at what stage of your training you are at now, and what are your aspirations for the future?
So I'm starting my second year of higher specialist training in physical and rehabilitation medicine, which means I've been working for about 6 years now. And I've completed my first year of residency of training in rehab. The way the program works here in Malta, it's a 50-month program. So it's 4 years and 2 months. 50% in Malta, 50% abroad. And we're encouraged to go to at least 2 different countries to make sure we get a holistic sort of experience from different perspectives of physical and rehabilitation medicine. And so I'll complete my second year in Malta and then it plans to go abroad. During my time in Malta, I started off with a 6-month rotation in our rehabilitation hospital. And then I've been having rotations in different specialties. So far, I've done neurosurgery, I had 3 months there, 2 months in ITU, and now I'm currently in my pain clinic rotation, which would be another 2 months. Then I've got orthopedics, vascular, and neurology.
And is there any area of PRM that you are very much interested in and you want to take it as a career?
Yes, and since I started, I've been keen on neurorehabilitation and specificity, as well as acute rehab, hyperacute rehab, acute rehab, and trauma. I haven't fine-tuned my decision yet, but I still think I'm early on in my career, so it would be a good idea to keep an open mind and see what the future actually holds for me.
And how do you think that BSPRM as an organization should help the trainees at Malta?
I think it would be sort of a step towards a positive direction if between MSPRM and BSPRM we could collaborate, because that way, once trainees gain perspectives from different countries, it would be able to broaden their the professional experience and perspective. And I think that having experience in the UK, possibly through BSPRM, would help us mature as clinicians as well. And even if perhaps we could have combined webinars, lectures, maybe courses as well, discussion.
Are you aware of any courses that BSPRM run, and would you be willing to come and participate in?
Yes, actually, I've already been to 2. So last year I went to the MSK course in Leeds, and this year I've been to the Master's course in Manchester, and both of them were an excellent experience. I learned a lot. I managed to network with other trainees and consultants there. So I believe there's a spinal cord injury one and the trauma one, if I'm not mistaken. But I'd like to look into that further.
And how do you see yourself in, say, once you finish your training, how do you see yourself working in Malta or somewhere else? And what's the future of the specialty involved?
So far, my plan is to come back to Malta and to rejoin Andre and Dr. Maestro and the team here. And that way, our small specialty or small team can start to expand, and we'll be able to have better community service as well for outpatient services, and we'll be able to be of better service to our patients.
But good luck with your future.
Thank you very much.
Thank you.